Sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
Committee under the chairperson of the Honorable Minister of Health, Dr. Lamin Ahmad Samate, on the presentation of the 33rd National Situation Report on his behalf by Dr. Mustafa Bite, Director of Health Services. Dr. Bite.
Good evening, ladies and gentlemen. Once again, we come to do the routine updates. So this is the 33rd National Situation Report since confirmation of the first case of the novel coronavirus in the Gambia on the 17th of March 2020, when the first case was reported in the country. So 30 new laboratory results have been received and all tested negative for COVID-19. The 4 cases who recovered newly from COVID-19 will be followed up for 2 more weeks. 1 new person, a Senegalese national, was intercepted and taken into quarantine whilst trying to sneak into the country through the Jibora border. A total of 99 contacts of the recently confirmed cases traced out of a total of 105. The country currently has 98 persons under quarantine, 3 active cases and no probable case. The 3 active cases are awaiting test results to ascertain recovery status. Globally, since 31st December 2019 and as of 22nd April 2020, a total of 2,634,529 cases of COVID-19 have been reported. Of these, 184,021 deaths were registered and 717,287 recovered from the disease. Senegal has recorded 442 confirmed cases, 253 recoveries, and 6 deaths. Currently, in the Gambia, we have 98 people on quarantine. A total of 397 tests were conducted and 10 are positive. 265 people completed quarantine, 642 contacts traced altogether, and 310 people completed follow-ups. So the daily coordination meetings are ongoing. And on logistics and safety, the following were implemented. A concept note on the establishment of COVID-19 safety and security task force at central and regional levels are being finalized. Non-infectious waste disposal currently being supported by the NDMA, whereas incinerations of infectious waste is ongoing at the NPHL. Distribution of donated items to regional health directorates is also ongoing. On surveillance and laboratory, the following activities are ongoing. Like we said, 30 new laboratory results received and all tested negative. 99 contacts traced and are currently being followed up for daily routine checks. Newly discharged patients to be followed up for another 2 weeks. On case management component, 4 of the confirmed cases recovered after testing negative for COVID-19 for the second consecutive time. 3 patients currently undergoing treatment at the treatment facility. They are currently awaiting test results to ascertain their recovery and subsequent discharge. Infection prevention and control training of security personnel with medical and clinical background is currently ongoing. Psychosocial support is given to patients under treatment and persons under quarantine and health workers involved. On risk communication and community engagement, the following activities are ongoing. 4 TV and 6 radio programs were successfully conducted. 1 press briefing conducted. 12 communities and 560 households sensitized or engaged on COVID-19 preventive measures using existing community structures. 21 members of the regional committee undergone training on feedback and reporting mechanism of affected populations. Finalization of the regional RCC plan and sub-regional risk communication and community engagement committee TOR ongoing. Summary of social media activities: 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 17,600 people reached. Summary of calls made to 1025. A total of 226 calls received. 214 were COVID-19 related and 12 were non-COVID-19 related. 6 booked for further follow-up by contact tracing teams and 6 booked for further follow-up by contact quarantine team. Regarding our next steps, the Minister of Health will embark on the following. So Minister of Health and the Risk Communication and Community Engagement Committee to work with municipalities on community engagement. Fumigation of the homes of newly discharged persons who have recovered from COVID-19. Intensify COVID-19 sensitization campaigns in Busumbala and Bundong. Introduce a car lock system for the COVID-19 response fleet in order to minimize fuel consumptions. Strengthen rapid response teams and contact tracing teams at all regions. Establish isolation centers in the major facilities and hospitals. Strengthen community surveillance in all regions, especially on designated border areas. Continue with the daily follow-ups of low-risk contacts and those discharged from quarantine. Encourage public reporting and self-reporting of suspected cases through the toll-free line 1025. We would like to thank all our partners in the fight against COVID-19. Sincere thanks also extended to the Students' Union of the Gambia College and the University of the Gambia in partnering with the Ministry of Health to raise public awareness on COVID-19 in Greater Banjul area. We are also grateful to AfriCell for the support rendered to Ministry of Health. We would like to appeal to the Gambia Ferry Services of the Gambia Ports Authority to continue observing the state of public emergency regulations on public transportations, which emphasized reduction in ferry capacity and avoid congestion in ferries and terminals. We would also appeal to household heads, parents, and caregivers to support and guide children at home and in the neighborhoods. We appeal to them to be active in the implementation of the state of public emergency regulations, including social distancing in their various households. We would like to renew our call for all private and commercial vehicle owners, as well as motorcyclists, to adhere to the regulations in their amended forms. Together, we can fight against COVID-19 in the Gambia. So thank you very much for your kind attention.
Thank you very much, Dr. Mustafa Bite, for that elaborate update and informative. Ladies and gentlemen of the media, men of the media corps, the floor is open for questions. Yeah.
The first question is regarding, we just want to go a little bit back. I think maybe you might be in a better position to answer. The incident at Basse, in where one man was ended up being quarantined, was quite a contentious issue, as reported in the media. Is it only one person up to date that has been tested positive for COVID-19 from Basse? Is Basse clear? That's what I'm trying to find out. Because if this virus is as contagious as they say, then it could be virtually impossible, given the difficulty it took to get that one person.
So thank you. The person, one person who was confirmed from URR was the only one so far. Out of that, we've reported more than 30 household members, close contacts were tested, and they were all found to be negative, and they've done their quarantine and they are fine. So yes, it's not impossible, because that was an imported case, and if you have a quick quarantine, the people who were very close to them were tested and are not found to be positive. So this is what we can say. So it's not an impossibility. This is what we are seeing happening. Thank you.
Because just a follow-up question to that, the individual, the fourth case was the case which I believe also affected another two.
From Busumbala.
Yeah. And that individual was quarantined and released, but later on got to be found out to have COVID-19. So that individual, all the people that he was quarantined with, were they tested? Then secondly, if he was released and then they got to find out later that the gentleman now has COVID-19, what about all the people that he has been in contact with?
So thank you. The fourth case is actually just being released. He was never released. So the fourth case came and was tested. When he was positive, he was taken to the treatment center. And he has contacts. Among his contacts who were put at the quarantine, before their time for release was up, they were tested. And among his contacts, 2 of them were found to be positive. And they were also brought to the treatment center. So it's not that he was one of the people who were released to go home and come back. His was an imported case, and when the symptoms were noticed, he was tested positive from home. He was taken to the quarantine center. Now it is the contacts that were with him, a big number that were taken for quarantine, and when they were about to be released, they were tested. And among those contacts, they found out that there were two positive ones, and those ones were taken for treatment. And we are happy to say that this one is amongst the ones being discharged now with his 2 contacts. So there was no release of him. And in this situation you are talking about has happened. That is in some of the cases that came from the UAE, where
that's the case that I'm referring to. The ones which were released and then later on.
Yes, so that has happened, but that's not the fourth case. So those were the subsequent cases. But yes, so that has happened. When they came, they were quarantined. Like they came from hotspots. They came in but did not have any symptoms. So they were quarantined. So after being quarantined for the period, because after quarantine, usually before you have to go home, we've explained that here many times, that when they release you, because that's what the protocol said, but when we decided that now we are going to do this, when we become very progressive, even though that's not the guideline, but we as the minister said this is what we are going to do, so we call back those ones who were discharged. And when we tested them, we found out like 2 of them were positive and 1 of them was inconclusive. So their contacts were traced again, and those are the new ones that are being quarantined again. And then before they are released, they will be tested. And if they are negative, they go home. If they saw any time during their quarantine, if they saw symptoms, they will be tested. And if they show symptoms, they will be tested, and if they are positive, they will be taken to the treatment center. But throughout the quarantine, if they don't show any symptoms, at the end, they will be tested, and if they are totally negative, then they go home.
So anybody that is going to be released will be tested?
Yes, that's a policy now, and that's going on. So that's why the 2 that were found to be positive were in quarantine. because it was time for them to go. So a big number was tested, then 2 were found to be positive. So then the following day, the others were released, then the other ones were taken for treatment. Thank you.
Thank you very much. Just as doctor said that once they are released in quarantine now, there will still be follow-up, because there's testing. Any additional question? Yeah.
Maybe anyone else? Li ma doon laajte tam mooy ci mbiru coronavirus bi gis nañ law enforcement agency ñoom itam lu bari ci seen liggéey itam xaw naa slagan tuuti muy maanaam pour enforce yenn emergency regulation laws yi ñu introduce ni biñ laajtee ñeena tam liñ dee wax mooy ñoom it dafa am fi seen doole am muy maanaam comme ni nga waxee ports ñun dem nañ fa def fa investigation gis nañ ne social distancing benn amut foofu ci seen waiting room bi tam dañ dee congest foofu tam a lot féeri bi tam daf dee xaaree mu mel ni féeri bi ci boppam tam ci seen biir amuñ dat social distancing bi ñoo wax biñ leen laajtee liñ wax mooy ñoom all the regulations yi nga xam ne yooyu lañ war a def muy matuwaay yi ñu war a def pour gis ne place bi mat na pour yóbbu ay nit mut na ci ñoom waaye pour gis ne enforce nañ lii tam loolu du seen liggéey ndax Ministry of Health tam mu ngi xalaat naka la moo doolelee enforcement agencies yi nii pour ñu mun a def seen liggéey régulier beneen tam mooy ci mbiru wér-gu-yaram lañ nekka surtout ñu ngi ci problème yi coronavirus bi muy jàngoro bi nga xam ne ci mbiru set la gën a amee doole ñu gis ne ñiy jaay mburu yi nii muy local tapalapa yi am su on ñu bari ci ñoom distributeurs yi rider lañ dee use te seen beer hands yooyu lañ dee use tam di jëlee bread bi di ko jox tam boutique yi tam ñu gis ne tam kuy jaay saabu kuy jaay leneen di seem loxo yooyu lañ dee use tam di ko laalee mburu yi tam ndax amut ay matuwaay yi ngeen foog ne war ngeen koo teg in place tam pour jàppale ni ñu mun a aar suñu bopp ci ñun naaw loolu nekk aliment lañ
Thank you very much, doctor.
jërëjëf si laajte yi am na solo waaw comme niñ ko waxee nit ku nekk nguur gi joxe na ku nekk sa doole si loi bi nga ko dee jëlee waaw loolu yëpp mu ngi si loi bi ña ko war a enforce waaye ku nekk am nga si cër mun ngaa seet naka nga comme borom bitig bi sax mun naa wax su nit yi ñëwee place am ne nii ngeen a rangee mu def fa ay line ni kii su taxawee fii 1 meter kii taxaw fële 1 meter soo ñun ñëpp dañu am rôle ku nekk am na lu mu si mun a def nag kenn warta toog di wax ne lii nekkul suma yoon lii nekkul suma boor moo tax waaye sooy xelal nit yi sax baax na soo waruñu egga bi fu nga xam ne dañoo wax sax di ñu forcer ñun loolu gënut pour Gambie lu gënoon mooy soo ñëwee si port bi nga war a dem si féeri bi nit yi seen boppa wax ne lu gën pour ñun si suñu health mooy ñu amaan mayewante 1 meter ñoom seen boppa su ñoo rang ñu def 1 meter waruñoo xaar pour ñu ñëw forcer ñu def loolu because lii dafa baax pour ñun baax pour dëkk bi yëpp waaw beneen tamit pour mu yombalal ko nit ñi ports borom bitig yi borom office yi banques yi commune bi nekk yaa war a defaral mu yomba pour nit ñi comme rang bi soo fa defee ay line nga wane ne 1 meter bi fii la 1 meter bi fii la nit yi na leen fàttalil ñu mun a taxaw even soo leen forcer wutee forcé bi boobu last resort la waaye mais bi nekkut ñoom seen wargal waaye ku nekka nekkuñ ci blame kenn waaye ku nekka mën ngaa def dara pour toog rek nga ne duma mën a def dara everyone has a role to play so mën nañ koo yombalal suñ client yi su nekkee banque nga amee su nekkee municipality su nekkee ministry la foo nekka rek make sure nga am poti ndox ak saabu bu nit yi mën a raxasoo make sure su nekkee fu nit yi day ñëw jël service la comme ID card wala license nga make sure ne nit yi ngeen xam seen place fu ñu war a em si rang bi ak am ñeneen National Assembly for example soo fa demee toogu yi dañ si salante waaye dañ def effort si diggante toogu yi nekk beneen toogu bi ñu def fa ex soo yow soo ñëwee rek soo gisee di nga xam ne waruma toog fii den nga toog si nekk loolu rek dana may distancing ku nekk da ngaa use sa imaginative way boo use bu nga xam ne dina mun a taxal yombal yëpp ku nekk sa kër tamit soo nekkee si kër bi da nga war a try ñu def ba nga xam ne di nga ko yombalal waa kër bi pour ñu def social distance pour ñuy sori wante su ñoo lekka ñun ñëpp buñ ñëw mi bi groupe noonu comme nu ñu def comme su Covid bi jotee comme weeri Covid bi ñun ñëpp dañ dee toog nii ñu lekka tugee mais bi su nekkee man maay borom kër bi naa xelaat ne waaw léegi since am nañ COVID-19 léegi naka laay def ba suma njaboot bi ñun ñëpp duñ toog nii di lekka di saxatante mais bi si COVID-19 bi ñu change loolu yow tamit di nga seet ne léegi xale yi naa leen defal ku nekk seen bool ñu toog o something yaay xelaat ñooñu dimbalee nguur gi pour ñu def ko so ñun ñëpp a war a am ownership bi second question boobu moo dafa am solo trop boobu ñu ñëpp suñu wargal la pour ñu seet naka leen fanxee feebar bi lii boobu dafa am solo trop nekkul pour Covid bi rek because loxo su setutee all the time lu mun a joxe ëpp na Covid mun naa joxe lot of many problems yu bari so loolu am solo la loolu weer ak Covid bi ak outside Covid lu ñu war a bàyyi xel la so raxas loxo yi moom dafa important bala nga laal mbuuru boo jox nit is ak mu fay teg mbuuru bi ak yooyu yëpp yooyu moom lu nga xam ne dañ ko wax ba noppi ba pare la because da nga war a mix sa loxo yi ñu ngi set all the time so kuy dem di def that distribution dafa war a am maybe benn small butéeli lifin sanitizer bu ndaw so tuuti rek nga raxas soo laalee sa baar yi saykul yi ba pare bala ngaa laalaat nga raxas because soo laalee baar bi yaa ngi ko dawal fii yëpp den nga ñëwaat jël mbuuru yi noonu loolu is not good so loolu lu may digal ñooñu mooy comme que duñ mun dem di raxasu waxtu bu nekk ñu amee seen hand sanitizer suñu wàccee si bàyyi baari cycle bi o baari moto bi nga pare rek den nga apply quickly bala ngaa laal anything loo xam ne nit daf koo lekka incha allah.
Any additional question? Yeah. Okay, what follow-up question?
Yes, li ma doon laajte tam again mooy sànq rek lañ gis ci internet bi tam mbiru Africell te dégg naa ñu ngi ko fi doon gërëm bu baax mooy xaalis biñ jël jagleel ko xeexi coronavirus bi ndax ci biiram tam amut ab sàggan wala ab xeebaande bi nga xam ne séntu nañ ko ci buntu jëwlin bi gàlloo wàllu wérgu yaram bu fekkee Africell ci boppam day dimbali ba noppi moom ci boppam mooy def ndimbal bi maanaam physically ni ma am xëy na yéen noonu ngeen ko war a def ndax fooguloo tam ne dina indi féewaloo ci seen biir ndaw yi parce que tey bu fekkee Africell mu ngay jox Samba Africell mu ngi yaakaar ne Samba frontline la te fekk ministre bi consider wut kooku comme frontline su boobaa ndax coow loolu du ci kaw ministre bi lay këppu at the end of the day.
so li ñoo njëkk a wax mooy ñu ngi gërëm Africell ak ñëpp ñu nga xam ne ñu ngi jàppale ministre bi moo tax ñu ngi leen a gërëm bu baax di leen sant lu gaay yi def ku nekk ñun ñoo leen oo ne ku nekk mun naa ñëw dimbale ba pare foo mun a dimbale rek fatal ñu fa rek ñun gërëm ne la sant neen léegi nag mun nañoo waxtaan pour gën koo jagar gën koo defar because Africell tey sax jógee neen fi am nañoo ñoom waxtaan yu baax and gars yi amuñ si lu ñoo def rek ba ñu ngi yokka many mën a war a plan so ñun ñu leen a gërëm di sant ba pare léegi yow soo xoolee suñ plan bi ñun bugga nañoo defal health workers yi yëpp dara so Africell ñëw nañu feeñu si loolu so I think ñun amuñ dara pour wax leen lu dul gërëm leen sant leen yeneen things yu si xew yooyu ay discussion la rek yu nga xam ne dañ bëggoon a oo gars yi ñu waxtaan naka lañ ko defee mu fit si plan bi very well te ñoom bu ñëwee everything went very well ñoom waxtaan bu set bu dëggu ñu gis ne ñoom seen xol Gambians leen rek ñu nga xam ne dañ bëgg a gis nuñ supporté Gambians so loolu tax ñu jël xaalis bu bari bi dugal ko si health te soxlawuñ si dara so ñun as a health ministry defuñ dara lu di leen gërëm di leen sant waaye nu ñoo work out modalities yi yoo leen doon detail out rek naka lañ ko defee fan la moo dem niñ ko senee ak ñeneen I think then isi details more because right now ñu ngi def lot of works on the background comme ñu ngi memorandum ñu kontaan nañ daal as a Minister of Health why we want to bring out those details su demee ba pare yëpp tey inshallah thank you.
Follow up to that if the letter which have been circulating on social media is anything to go by it really contradicts based on what you are saying kontaan nañ and things like that it shows that you are even disappointed with Africell the way they are dealing with things. And above all, we know that this issue started at the RBPD, which is next door. Our main hospital. If someone has to go there, do whatever, talk to the media, up to the time that the individual have to travel right across the country, go to four other health facilities across the country. You said you are not aware of those moves. How best can Gambian believe such a statement? And above, secondly, on the same issue, we have asked the same question immediately when Africell did the first donation here at the press conference, where we pointed out some of these issues. That if Africell is doing it for 5 5 hospitals. Hope there will be no controversy between you and your workers in other departments. But what we are being told here was these are phases. Everyone will be satisfied. Meaning it doesn't mean only the 5 hospitals selected by AfriCell will be the one to benefit from the AfriCell package. So in relation to that, is it that the way AfriCell did it, it shouldn't be like that, or how?
Yeah, so for us and AfriCell, like we said, we are grateful to AfriCell and we appreciate the efforts. This is people using their own resources coming to assist, and as a ministry we appreciate it. Like I said earlier, we are just trying to work out the modalities on how it's going to go and what is needed and the details, and that we are in the process. And it has even become better and more improved. So about the other issues about the hospitals going and all, yes, so you may be aware, but sometimes, it's just the channel. You may contact the right person and maybe the information did not reach and all those type of things. So that's why AfriCell were called and we discussed with them so that we hear exactly from them and have a very frank discussion, very fruitful discussion, and we agreed on terms and modalities that we are going to go ahead from here.
So far, did any health worker receive any, or nothing have happened yet?
So you were asking about other details also.
Yes. We asked here earlier during the first day of the whole issue, and we are told that everyone will benefit from the said package.
So everyone from the government, health workers, we have a package for them, for the health workers. But AfriCell, like I said, we've reviewed the discussion, we've reviewed everything, and then we are coming out with an MOU which will detail out all this. And I'm saying that it's even better, and the discussion was very helpful, and it's more fruitful now for both the country and the health workers. Yes, I think that's it.
One final question from... You have a lot of things to do, so you just have to ask your questions. Yeah, tomorrow the minister will come, I drag him because they are working on a lot of documents so that we can do these things. So, yeah, tomorrow the minister will be here. Yeah, you have something to ask?
Yes, good evening. You mentioned in your statement that you really want to intensify efforts in creating awareness in 2 communities, that's Kutumbala and Bulu. Why those areas?
So thank you. That's a difficult one because from the risk communication and the problems we are seeing, it's not only those communities, but what we are seeing is that surprisingly, there's a big denial. You have people thinking that this COVID-19 is a hoax. It's not true. The ministry is doing it. And it becomes more worrying, even in communities, for example, where you have a suspected case or you even have a confirmed case, and there's too much denial around there. So I think it's good. I think the perception of the society, it's important. So that's why the risk communication is engaging this group. But we need to intensify what we are doing, especially in specific areas. Not only that, we are just starting, but we've gone to other, like they've gone to Sabbi, they've gone to other places, and we are going to, but now, because of the history of, you have a confirmed case, and they've gone to do a lot of work there. The same thing happened around Bundung before, and they went intensify, and people have gotten it. So this is the same strategy they want to use there also to ensure that the denial we are seeing is scary, and we want everyone to be on board to understand that this is true. This, and Minister has been saying it, let's take it very serious. It's true. I mean, you can take our word for it, really. It's a serious disease.
One final question for the day. No, do you think we have a lot of work to do? Ask him. I drag him for tomorrow. The minister will be here. Any final question? Yeah. Okay, ask your final question. Tomorrow we'll have another opportunity.
How many journalists here?
No, let's not argue. Ask your question. The files are waiting for us. Gambians are waiting for us. We have a lot of work to do. Ask your question now, please.
The question is, around sometime in March 15th, if I'm precise, there was a 3-month plan, budget, $2.5 million US dollars, which it is almost 125 million Gambian dollars. That was what the budget was stated was. What's the status quo? Because $125 million, but now 1 month later, less than 3 months, they have spent 143 million Gambian dollars. Tell us what's going on, please. What's the budget right now? What is going on with regards to the expenditure?
So thank you very much. So I don't think it was March 15th. That was earlier than that when we brought out the first. When we brought out the first plan. The first plan initially was just a 3-month plan, like you said, and it was around that $2.5 million. But soon after, 8th March, then we brought out another plan which is more comprehensive, and that was 8.8 million. And now, even that, we are reviewing it. Because the COVID, like we said, keeps changing. The plans keep changing. Like, for example, the common example I like to give is when we were doing the plan, we were not thinking of doing mandatory quarantine. We were going to do home isolation, which is cheaper. You don't need to have a hotel. You don't need all these public health officers stationed there. You don't need security if you do home isolation. But midway, we noticed that you have to do you need to do mandatory because that's the best method. So you have to change your strategy, and it has cost implication. And for example, you come to the projections. Initially the projections were not. Later you are having big projections of what will happen based on what was happening in the day. Because initially, when the disease started in China, the fatality rate was very low. We're talking about 0.1. Out of every 1,000, maybe one will die. But later we were talking about 50. It's going to 5%, more than 5%. So then the case fatality rate changes, then in your assumptions, in your modeling changes, then you start to have big numbers. And so that will also translate into the equipment you are going to need. Initially, when we did the first budget, for example, the number of equipment for ventilators we put were small. Then when the projections change, you have to also change that. It also means, and these equipment are all expensive, and it changes your plan. So this plan is dynamic. It's not just going to be based on how much we are learning about the disease, then you change the plan. So your projections, if you're going to now have more patients, that means you are going to need more PPEs, you are going to need more consumables, and your plan will change. So at the present, we are on the process of, the review has been taxed on some people to start working on that, so that the plan is reviewed and it depicts what is happening currently in the country.
So the 143 million that has been spent, when will the public get to have a breakdown on what this 143 million has gone into? The minister has said that, the finance minister has said 100 was spent on Zhangzhangzhou for ambulances and some equipment. And the 43 million was spent on local expenditure, which is on the feeding and the hotel. So, how many people have been quarantined in total, to get an idea of this? What can you tell us on these 143 million?
But the quarantine is routine data that we give, like every day, how many total number of people quarantine and all that. So for example, today, as of today, we said that 265 people have completed quarantine and 98 are in quarantine.
265?
Yes, 265 people have completed quarantine and 98 are currently on quarantine.
So that's if you do the math, 43 divided by... Okay.
So that is the number that has been quarantined. Okay. Yes, and then your second question?
The breakdown, if you can give us an
idea. So I think in due course you will get the breakdown because the things are procured. We are trying to get them because it's very abstract if we probably give you the breakdown like that. So, but when you see the equipment, then you can contextualize it. So, thank you.
All right.
Thank you very much. We'll work on everything. All the information will be available, and say this is an open government. Every day this is ongoing. You have the opportunity to ask your question, and all the information that you people are asking will be available in the public domain. On that note, thank you very much, Dr. Bite, for your understanding. I know I have to drag you literally from the office because we have piles of files that are waiting to be processed. Ladies and gentlemen of the Media Corps, thank you for your patience. See you tomorrow, the same time. Here, thank you. God bless you.
Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary